Man, why are so many people struggling with infertility? According to the CDC, in the United States, among married women aged 15 to 19 with no prior births, about 1 in 5 are unable to get pregnant after 1 year of trying. Also, about 1 in 4 women in this group have difficulty getting pregnant or carrying a pregnancy to term. Infertility can be discouraging and lonely. So I wanted to chat with a fertility specialist today to bring some hope to those in this situation. Even if you're not the one struggling with this, you're going to find this conversation with Dr. Briguglio and her natural approach to fertility very interesting. We've got a lot to cover, so let's get to it. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. So this is a place where you can learn about healthy living and take the next step in your wellness journey. Hey, Daily Wellness listeners, have you ever wished for specific guided help with your health journey? Maybe you need someone to teach you about menu planning or how to get your whole family on board with healthy eating. Maybe you need recommendations for non-toxic cleaning and personal care products so that you can finally make the switch. Now, you and I can chat one-on-one about whatever health topic you'd like. For more details and to schedule, go to dailywellnesscommunity.com/coaching. Now back to the episode. Dr. B, thanks for joining the Daily Wellness Podcast.
Hi, thanks so much for having me. I'm really excited to be here.
Yes. So I really wanted to bring you on because I've seen you talk about this a little bit, and it's kind of the fertility crisis going on in America. I mean, I've heard a lot of doctors and health practitioners talking about it, just with the dramatic plummet of sperm count in men, the amount of people seeking fertility treatments in general. So I just wanted to, first of all, get your input on that. What are your thoughts? Do you think there is a fertility crisis right now?
Yeah, that's a great question. And it's one that I feel is actually kind of hard to answer, right? So there's a reason for that. And it's because more people are talking about infertility struggles than ever before. So there's one side of the coin where it's like, are there just way more couples dealing with infertility, or is it that more couples are actually talking about infertility? I kind of think it's a combo of both, in my opinion. I think, yes, infertility is on the rise. I think if you do look up some of the statistics, it used to be 1 in 8 couples. Now it's some places are even saying it's 1 in 6 couples that are struggling. And so, there's that piece of I definitely think more people are dealing with that. But also more people are educated. So, some people who thought, oh, we're just going to keep trying, and they'll maybe try for 2 years without getting help, and then they get pregnant. They didn't know if that was right or wrong. So education, and then also that conversation of just people being more open to sharing their story, seeing people on social media share their story, feeling like they can share and be open. So in summary, basically, I think it's kind of a combination of those two things that are kind of leading to this, crisis that you're talking about.
Yeah, true. Okay. Well, before we get more into that, why don't you introduce yourself a little bit and tell us about you?
Yeah. So, hi, I'm Dr. Samantha Briguglio. I go by Dr. B. Totally fits my personality more, and it's easier to say. I specialize in hormone health in general, but my specific niche is fertility. And I am the owner of the practice Walk the Natural Path, Hormone Health and Fertility Care. So it kind of just says in the name what I specialize in. And walking the natural path, I'm a naturopath. I love natural methods. I believe in the body's innate ability to heal. I believe in treating the root cause. And I believe it has such a massive impact on fertility. And that's why I'm here. That's why I do what I do.
Yeah. So the people that come to you in your clinic, what are some of the main problems that you're seeing in your clients?
Yeah. So to be honest, it actually flows, ebbs and flows a lot. I usually see a lot of the same thing at once, and then it will shift a couple months later. So for a while, PCOS was the big one, right? High androgens, high testosterone, insulin resistance. That was a really big one for a period of time. Currently, it's a lot of endometriosis. That's a really big one right now. But, I also help greatly, I feel like majority with unexplained infertility. That is a big one and probably my most prominent, right? Because usually when people are just seeking out like natural methods or like a naturopath, I feel like, unfortunately, it's like this, but we're kind of like that Hail Mary. Like we've tried everything else, but like no one can give us answers. So I see a ton of those cases. And usually with unexplained infertility, it's a lot of little things that are adding up to having them have a difficult time to conceive.
Yeah.
Right?
Well, that's great. Because one of my questions is like, what is causing people the problem? Like, what is the trouble with so many people having trouble conceiving right now?
Yeah, I think, right? Like, and a lot of people are getting that everything looks good. We don't have an answer for you, right? One, I think that has to do with how the doctor's actually evaluating the couple, right? Like how they're looking at their labs, like normal versus optimal values. And two, I think it has to do with, the lack of focus on diet and lifestyle and people being like, well, all your labs look okay, you're fine. But, most of the people that come to me who have unexplained infertility, they're actually even struggling with their period or cramps or chronic migraines and headaches or gut health issues. And I'm like, okay, clearly everything's not fine or normal or optimal. Like you're going through all these other things. We need to get your body as healthy as possible so it wants to create a home for a baby.
Yeah, they've probably been told that is kind of normal. Well, a lot of people have irregular periods. Well, a lot of people have pain with their periods.
I know, it drives me crazy.
Yeah.
It's like the biggest thing. I'm like, oh my God, what?
Yeah.
It's fine if you have to call out of work every time for your first day of your period. I'm like, you might feel a little bit more tired. You might feel a little bit uncomfortable, but you should not be like feeling really nauseous or like bent over or like I have no energy to do anything.
Can't go to work, can't go to school. Like, yeah.
Yeah.
I agree. So you mentioned like PCOS and endometriosis and all of those things like factor into fertility, right? Because I know a lot of people with those diagnoses have been told that you'll likely have trouble, having a baby.
Yeah. And honestly, it's interesting. Both of those are actually very different. They get bundled a lot. I just did it by mentioning them together, right? So just think of them together. Personally, a diagnosis of endometriosis, I'm just going to be totally upfront. That one is harder to work with. I work a lot with it. I think I've seen a lot of people get pregnant naturally with it, but it is a harder one. And it's one that actually needs the most amount of individual care, I find. Like that one is definitely needs to be very specific to the individual, in my opinion. PCOS, on the other hand, I feel so bad for the people who are struggling with the PCOS in the sense of like, most of the time they're not getting their cycle or they're not ovulating and people just keep throwing medication at them. And, sometimes it's like some tiny little tweaks we do and then they get pregnant like so fast. And some of them have been like trying for years and they're like trying not to get super frustrated because they're so excited that they're pregnant now. But they're like, that was so much easier than I thought. And I'd been trying these other conventional ways for so long and it wasn't working. And so that was kind of my own little tangent. It's something that obviously bothered me. But, I feel like there's so many different options for, each of those. And they just need to be treated individually for each person. And
for sure.
Mindfully.
Mm-hmm. Yeah. That makes a lot of sense. And when you work with those people, like, is your goal to help them find healing from those diagnoses? Like, is that possible? Or do you work around it? Or what is your approach to that?
Yeah, that's a great question. So I actually do take slightly different approaches depending on if it's just for like hormone health versus fertility. Fertility is a little bit more like one-track mind, or our goal is to get pregnant. I do really try to create sustainable lifestyle habits for them to just continue on even later on. But at the end of the day, like there are a little bit more supplements and herbs involved than just like a regular hormonal healing piece, because we do want to accelerate the timeline as much as possible, with being doing things naturally and more patient, right?
Right.
So, at the end of the day, we have to be mindful in like what is the goal of treatment. Yeah. But with the PCOS side of things, focusing diet, lifestyle, and the supplements can go to healing. You can start to heal and honestly not even really need the supplements anymore.
Right. So you've seen people go into remission from those things.
PCOS, yes. Endometriosis, like I said, it's its own thing. It's a little bit harder. Some people also have like stages of endometriosis and don't even feel a thing. Like I just had a patient who had silent stage 4 endometriosis, which is like crazy to me. For those who don't know what that is, stage 4 is like technically the maxed out stage. Some people will say there is like a stage 5, but like stage 4 is like pretty severe, and she had no symptoms. And so at the end of the day, like remission, I can see things in endometriosis. Like, we can see the endometriomas get a little bit smaller, which is nice. We can see, pain reduce and things like that. But endometriosis, I don't see as much remission as like a PCOS picture.
Yeah. So when people come to you, they probably typically tried some things before. You kind of mentioned that. Like, what are some things that people have already tried?
Yeah. So I actually get a ton of people who have tried IUIs, like multiple, IVF, also multiple rounds. Honestly, acupuncture too, other Chinese herbal medicines. I mean, the specific route isn't going to work for everyone, right? Like everyone needs to find what's going to be the best for them. But yeah, I find a lot of people come to me after IUI and IVF.
Yeah. And I mean, you mentioned kind of doing labs for people. So is that how you know, like based on what the labs that you do, that's how you know what treatment plan might be right for them?
Yeah, labs and also symptoms. I think people undervalue looking at symptoms a lot because, it's like our bodies, the coolest part about a symptom is that it's our body's way of trying to express like what's going on, and it's communicating to us. And so learning to really evaluate what's going on based off that communication is, I think, really essential, honestly.
Yeah, that makes a lot of sense. What kind of labs do you do?
Yeah, so obviously hormonal labs. A lot of people ask the question, like, does it matter what day? I believe it does. For day 3 labs, I really like estradiol, FSH, LH. Like, I'm like, let's really get those done on day 3. There's a lot of other labs that I draw that aren't as specific, but those are specifically day 3 labs. For those who are not sure what I'm talking about, it's like your 3rd day of bleeding. That's what I'm talking about, day 3 of your cycle. And then 7 days after predicted ovulation. So for a lot of people, that's like around day 21, but it's very different for everyone. So don't always count on that. And I like to get a progesterone done on there. Like I said, I do like a lot of other labs too, but those are the ones that I feel like are very specific to the cycle.
Right. Okay. And then you, based off of that, you could recommend a treatment plan, which includes diet and lifestyle changes. So I'm curious about that. Like, what are some recommendations you typically give people?
Yeah. So I feel like I actually made a reel about this joking because I'm like, this is what I think like conventional people think that naturopaths do is like drink more water, sleep more. And it's like, we just say that. I'm like, no, it goes so much more. It's so much deeper than that.
Yeah.
So like, for example, today I had a patient and one of their biggest things that we need to work on was stress. That was causing a lot of inflammation. And I will never tell a fertility patient not to stress, but we need to figure out how to manage stress, right?
Right.
So we spent like 20 minutes coming up with a plan. One of their biggest concerns was that they feel guilty resting. And when they rest, they feel guilty and it creates more stress. And there's this like ever-ending cycle.
Yeah.
So we worked to brainstorm a way to help reduce that guilt, whether that's like, going to therapy to get to the root cause. But for me, I felt like we came up with a really good idea for her. And that was making a list of things that need to get done that day, like non-negotiables, so that when that list is done, she can sit down and just relax and take time for herself, knowing that the next day she'll have that new list and be able to get that done as well. And what that list included was, what she has to get done for work that day, self-care things. So like making your breakfast, eating lunch, working out, having movement, taking a shower, things like that. And then like maybe 1 to 2 house chores. And then have another list for the next day. Yeah. So it's not like, here's this list of house chores on top of all the work I have to get done. That seems super, daunting. And I feel bad sitting down because I know I have all these things. Instead, you're like, no, I'll get it done tomorrow. I have my list.
Yeah, I can totally relate to that. I'm an achiever, and I like to get things done. And so I don't know if I felt guilty resting, but I just enjoyed achieving more. And so it was hard for me to take time and rest. So I almost had to think of resting and like taking time to just kind of de-stress as an achievement. Does that make sense?
Yes. Yeah. 100%. Put that on your list too.
Exactly.
Add that to the list of like, I need 2 hours of me time to rest. That's on the list. That counts. Yeah. It kind of goes back to like, what's your definition of success?
Yeah.
Right. A lot of people, I ask that question too when they're stressing or high achievers. And they tell me what it is. It's usually something that's probably adding to that stress. I'll be like, okay, we need to change your definition of success. You need to change your definition of a productive day. Right.
Yeah, that's good. Yeah, I'm glad you can speak that into people. I love that stress is a part of the conversation when it comes to fertility because it is such a big driver of inflammation. And I know that like if we're just living in that state of stress, we can't heal. Right. And so we've got to do something about that.
Yeah, exactly. But more than the don't stress, go on vacation, have a glass of wine.
Right.
Right. Like it kills me. I'm like, no, let's make this actually productive.
Right.
Those other things are not helping. Like
maybe relax 1 week out of the whole year. Yeah. On vacation. And yeah, we're good.
Yeah. So it's not helpful. It's not helpful at all. So yeah. So that's just an example, but obviously, we do that with everything depending on what the person needs, right?
Mm-hmm. So thinking about the lifestyle piece, since you're especially working with hormones, do you give some guidance on products that people should and shouldn't use in their home?
Yeah, for sure. Like I said, meeting kind of people where they're at. So
yeah,
sometimes we talk about sleep habits. Like I talk about that a lot. Also alcohol use, tobacco use, marijuana use, quitting those, finding, like you said, good products, good clean products to use. I used to just like, I kind of tell people to start with just like every time they run out of something or just replace it with a clean product because, it can be really stressful to just wipe out environmental toxins. But like the biggest things would be, having filtered water, drinking from like stainless steel or glass, storing your food in glass, and then like replacing products that you use every day. Those are like big things. And then just like try not to like get too overwhelmed by the rest of it all.
Yeah. Getting rid of the plastic. I love that. A couple of things that you mentioned. Yeah.
Mm-hmm. Yeah. Also like don't use the extras. Like, you can find a non-toxic candle if you like it, but like you don't need fabric softener. Like don't use fabric softener. It's not necessary.
Yes.
Reach it. Yeah.
Fabric softener is the worst.
Oh my God, it's so bad. I'm like, what is this even for?
Yeah. It's to coat your clothing so that you're like, wearing this coating of something that makes you feel like it's soft and it's just gross.
Yeah, it's not good.
Yeah. Okay. So what is the typical modern medicine approach to fertility? I know some things that like, so if somebody went to a conventional doctor, what would they be told most likely?
Yeah. So a conventional doctor. So just to like have people really understand like the options, there's usually like the reproductive endocrinologist, then there's like a NAPRO doctor, and then there's usually like a me, right? Like the functional practitioners. NAPROs are kind of like in the middle, right? Between that. And so just so people know, I think there's so many different good options and you'll be able to find out in that. Reproductive, like general conventional medicine will be, they'll have you come in. Sometimes I hear that they'll do a bunch of tests for people. Sometimes I'll hear that they won't. They usually make sure like minimum that there's like an ultrasound and an HSG done, which is really good because you want to rule out anatomical issues. So that's going to be something that can be really helpful. But then a lot of times some do hormonal labs and some don't. I've literally heard patients be like, I've been given the diagnosis of unexplained infertility and they didn't even test my progesterone, which blows my mind, but somehow it happens. Now, not all REs are like that. So I want to just definitely make a point to say that. Some of them do a decent amount of workup or as much as they know from their training to do, which is really helpful. And I think that's really awesome. But usually the only other method that they have is to go to letrozole, Clomid, IUI, or IVF. And so that's kind of usually where they take a patient to after they say like, you can try maybe a timed intercourse cycle with medication, but then other than that, let's go on to these things.
And then what would you say is what you offer in comparison to that?
Yeah. So then what I offer in comparison, I actually totally support like getting like the anatomical things done. I want to rule that out before we're like doing all these other things. Like we need to make sure you have a patent fallopian tube. So that's a really great piece of information to have. But I go into like labs, I don't, we ask about your reproductive system, but we also ask about your endocrine health, your skin health, like your gum health, I think I already said gut health. I don't know. I just need to emphasize it a million times.
Yes.
All of these, we look at the whole picture to see what's truly going on. And I'm a huge believer in making sure we look at both partners.
Yes.
With like a semen analysis, but like also the partner's gut health and thyroid health.
And lifestyle, right?
Exactly. So I feel like, obviously, I look at a more holistic approach. I obviously spend a lot more time. My visits are like 60 to 90 minutes. So there's a lot of information that's being shared, which I think is great. And I personally don't know how people can honestly treat fertility without that amount of time.
Mm-hmm. Yeah. And I had a question thinking back about our PCOS and like endometriosis and those kinds of things. Do you think like some of the things that you are doing to treat those things, we're addressing diet and lifestyle. So if those things help to heal, are they also causing it, like on the negative side? So if you have poor diet and lifestyle, is that what really leads into those conditions in the first place?
Yeah, I mean, sometimes, right? Yeah. There's different triggers for everyone. So environmental things that they didn't even know about. So like even exposure at like their job. Sometimes it can be they're more have a greater genetic disposition to having things like PCOS, endometriosis present. And then like a big event happens, which like triggers the onset of those genetics. And so then all of a sudden it does present. Same thing with like Hashimoto's or thyroid disorders.
Yeah.
But then it can also be exacerbated by the diet and lifestyle. And you can send things into like remission, as we were talking about before, by improving all of those things. I like to use this analogy that I think is really helpful for some people to understand where like the healing comes from, because a lot of people also change their diet and lifestyle and they're doing a really good job, but they still get stuck in a rut and they still can't heal. And so what I kind of say is it's very hard to really kind of make a specific analogy, but so just stick with me here. It's just like an example. But what I like to say is like, okay, say your gut health, you have like E. coli, right? Say you're exposed to E. coli. You could eat as healthy as you want, all the good fiber, all of the things, but sometimes your body can't fight it off any longer. And so you need assistance with some herbals, some antimicrobials, some of the supplements to help kill the E. coli and then nourish and get you back to optimal health before you can just take off with diet and lifestyle again. So it's kind of the same thing for like the diagnosis like endo and PCOS. Sometimes we need to help nourish with some supplements and herbs, then give your body the chance to work with just the diet and lifestyle things and then kind of go from there.
Yeah, that makes a lot of sense, I think. So what would your encouragement be to someone that is really struggling with, maybe they're kind of at the beginning of this journey and they're not sure what to do?
So I think my encouragement would be to honestly, this is always a hard question. I think I like to tell people that there's always another way. So something that I think is good to hold on to is that there's so many options in this world. You might have a harder time finding some of them, but there's usually always another option. Mm-hmm. And I think it gets really discouraging for a lot of people to hear like IUI or IVF are your only options, but I wholeheartedly don't believe that for majority of cases, right? Like some people like have an anatomical issue where it's like you do need surgery or you do need to have IVF, right? There are the exceptions, but for majority, I would say that there's usually always another way. So I think that's encouraging. Mm-hmm. I think also hearing that listening to your intuition is important. And I think a lot of people snuff it so much. But if my patient tells me they're like struggling with this and it just seems really in the forefront of their mind, I listen to them. And I'm like, and I'll tell them, don't ignore your intuition. Like if you feel like that's something you need to do and focus on, do it, because you know your body better than anybody else. I am not inside your body, right? Like I do not know what's going on in your system. You know it better than anybody else. I can make my assumptions based off my labs and the symptoms and all the knowledge that I have gained over the years. But your intuition is powerful, and listen to that. So I think those would be the biggest things.
Those are awesome. Yeah, it's a great encouragement. I imagine people come to you feeling pretty hopeless at times.
Yeah, it's definitely a hard thing to work through. And I think people do feel hopeless. My goal is to give them some hope. I'm very candid with it where they're at. So I'll always be very honest with them. But I think, snuffing out hope completely is useless. Like what does that do for anybody? Like hope is powerful.
Yeah. Can you give us a couple of examples of turnarounds that you've seen in your practice?
Oh my gosh, I have so many fun ones. I don't even know. But biggest one that I've actually shared online recently, which like totally made me cry like 6 months later. It was like this kind of crazy moment where I was like, wow, I didn't like feel that when I should have. Where I had someone come to me after 7 years of trying.
Wow.
Done IUI and IVF. And one of their big issues was PCOS. And this is where I was kind of like, this is one of those frustrating cases for me because I think we worked together, and I think within 6 months there was a pregnancy, and now they're pregnant, and it's been like everything's been healthy so far. They haven't had the baby yet, but like it was incredible. I was honestly myself, I was almost like, oh my God. Like, it was one of those moments of just like, wow, like when you had seen the list of like what they had tried,
and think about the money that was spent, like all the money. Wow.
Also true.
Yeah.
And I'm just like, oh my God, like it was one of those that floored me and like made me like also be like, oh yeah, natural medicine's awesome, right? Like it's just so cool.
Yes.
That was a big one. Another big one that was a couple who actually struggled. They had miscarriages and then had no positive pregnancy tests for 2 years. And then we did gut health. I was like, let me check your gut health. Let's work on it. And I was like, during this time, there's going to be about a 8-week period where I'm like, let's make sure that, you try not to try. Let's try not to try because, sorry, I like totally like stumbled over my words there. Like, it was like, basically, we're going to pause on trying, which is really hard to tell someone with infertility, by the way. I hate having to say that. But I'm like, let's just not try to get pregnant when you have a bunch of antimicrobial herbs going on.
Yeah.
So she's like, okay, we'll definitely try not to. And I was like, if you do, it's fine. Just stop the herbs. But like, let's try. She messages me. She goes, I cannot believe I'm saying this, but I accidentally got pregnant. And I am like laughing, crying at this point because I'm like, what a thing for someone with infertility to say, right? I've been trying for 2 years, no tests after multiple miscarriages, no positive tests. And now she's doing this thing and she accidentally got pregnant. And in my mind, I was like, your gut health, like there was about 5 weeks of treatment where I was like, it was just enough to be like, okay, I'm ready now.
Just like a switch. Yeah.
Yeah. And so I was like, just stop the things. Like everything's going to be fine. Her pregnancy's been super healthy since. But like, I think that's such a cool testament to like what can happen when we don't miss those things that people like write off as unimportant or too little, or that's probably not being the thing that impacts it. Right.
Yeah. Yeah. Well, I mean, I feel like we've covered a ton. If there's something that you feel like we haven't covered, let me know. Because I have 3 fun questions to end with. So what do you think? You ready for those?
Yeah, I think it's great.
Okay. First one is, what is your go-to morning drink?
Oh my gosh, I'm so boring. Water.
That's actually great. Like all of us were like, I wish we could just drink water.
See, right there when I hear that, I'm like, ooh, we need to work on your adrenals. All right. So I love water. I love having a glass of water in the morning. I feel amazing. It's just like, I mean, you go to sleep, you don't drink water all night. So it's like replenishing, it wakes you up. Like, I love it. A lot of people like to add lemon. I'm not going to lie. I'm almost like too lazy for that. So just drinking a glass of water. Usually then after like I eat and stuff, then I'll maybe make myself like some tea or something. But
yes. Yeah. Well, that's kind of like me too. I'll make sure I take a few big chunks of water with a sprinkle of salt and then I have my tea. So
love it. See, that's perfect. As I drink my water right now.
Right. Second question, what's your favorite way to de-stress? I know we talked a lot about stress in this episode, so give us an example of what that looks like for you.
Yeah, honestly, I'm a big extrovert. So for me, being around my people, Like, I love to spend time with my family and my friends, and that makes me feel grounded and makes me realize, like, this is what life's for. So that's my favorite thing.
That's awesome. I love that. And who would you love to see as a guest on the Daily Wellness Podcast?
Ooh, that's a good one. I'm actually friends with her from school, and I don't know if you've known her, or maybe she's actually been on here, but Dr. Saru Bala.
Oh, no, I haven't had her yet.
She does hormone health as well. She was actually a grade higher than me. She was like she's like one of my mentors, kind of, by getting my license here, you know, all these like technical things. She's hilarious and definitely gives you her very clear opinion on things, and she's an amazing doctor. So I would recommend that. She's awesome.
Okay, great. Thanks for the recommendation. Thank you for sharing. I'm going to make sure I have all your info down in the show notes so that people can kind of connect with you and continue to learn from you. So thank you for sharing your heart today.
Oh, thanks for having me. It's been great.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.